As we age, it's natural that the body's tissues, tendons, and muscles tend to weaken somewhat, but that doesn't mean having to stop living active, healthy lifestyles. Women especially can be affected by weakening muscles that surround the bladder. However, this is not a part of aging that has to be lived with. Here to share some insight on this condition and treatment is gynecologist Nicholas Sholty. Dr. Sholty, thanks for being here.
Thank you very much for inviting me.
Well, when we were talking about this problem earlier before we went on the air, we said it's not really a more common problem, but it's a more relevant problem. Explain why you put it that way.
Okay. Incontinence, which is urinary leaking, has been around forever. It's been around since childbirth. Now women are becoming much more active. They're leading active lifestyles. They're becoming soccer moms. They're out in the workforce. And it's a little difficult now for these ladies to endure the problem with leakage. Years ago, when ladies were at home and they just kept the family going while dad was out at work, this perhaps was not as much of a visible problem as it is today.
Well, are there different types or different levels of severity of the problem?
There are. That's a great question. There's a lot of different types. There's 3 major types, but the one that we really want to focus on that we can help the most is going to be what we call stress urinary incontinence, SUI. And the main result of childbearing. Now, there's a lot of other reasons, but by and large, the majority of ladies suffer with this problem because of having had children. And as a result of that, we see this very, very often with ladies that have had at least 1 child or more. The more children, the worse the problem can become.
Are there other risk factors, or symptoms or anything that's hereditary or anything else that
Yes.
might add to the equation?
Yes, there are. There's a lot of other issues that we need to look at. We're upright animals, basically. And because of that, we are exposed to the forces of gravity. Well, when we have weakened ligaments, as a lady does in this problem, gravity is not her friend. And I think that a lot of ladies will also say gravity is not their friend for a lot of other reasons. But in our case, it's not a relevant issue in the sense that we can't change it. We are upright, we walk, gravity pulls things down. So that's one risk factor. The second one is obesity, and the other things that we all hear about is smoking and chronic diseases, which all contribute to the weakness as well as to the prolapse.
Well, so when should a person decide to get help for this?
That's an awesome question because I hear that question all the time. More specifically, I hear, oh gosh, it's too late for me. When should I have come to you? The first sign that a lady has a problem is when she should go and seek a gynecologist. A gynecologist looks at not only this problem, but also other problems that go along with this, because incontinence is just not urinary. There's gas incontinence, there's stool incontinence, and when the ladies first recognize these problems is when they actually do have to come and talk to us about it. Now, there's other specialties that deal with these areas, but not as comprehensively as we do. We deal with the gas, the stool, and the urinary incontinence, whereas other specialists will only deal with one or the other areas.
Well, tell us a little bit about the types of treatment and what could be expected both in the treatment plan and the end result.
Okay. Treatment is actually aimed at restoring normal bladder function. The first thing to do is going to be to try to assess which of the types of incontinence the lady has. Some of them are able to be helped, others unfortunately not. Even those that are able to be helped, sometimes if it's long-standing, it cannot be helped any longer because the damage is so severe. First, we try conservative methods. I think most ladies have heard of Kegel's exercises. When these are of no more help, that's when they usually come to see me. But initially, it's going to be pelvic strengthening exercises.
Okay. Well, are there any side effects, or is there surgical treatment?
Yes, there is. Once we reach a point that the conservative methods don't work any longer, then we assess her for repair of the structural problems. And again, it's aimed at reconstructing the pelvic floor to function as it did before these problems occurred.
Now, is this something that they should be having a conversation with a family doctor, with their gynecologist? How do they open that conversation?
Jeff, it's really interesting because I find that my patients are more comfortable talking to me as their gynecologist about this. I've been doing this here in Pensacola for 20 years, and it's one of those specialties where you develop a sort of a rapport with your patient, and there are easier conversations for us to have. A family doctor may also be able to do the same thing, but we have all the tools necessary to assess it right off the bat. And again, it's a little bit easier to talk to me about this after I've seen the lady for the last 10 or 15 years and I've delivered her babies and gone through all the gynecologic milestones with women.
Well, if you do decide to go the surgery route, what type of recovery, and just a little bit about the procedure and the length of time away from work, as you mentioned, that's one of the more relevant aspects, is that women are more active and in the workplace or going places with grandkids and that type of thing.
Well, it depends pretty much on what we're looking towards in terms of repair. It can be anywhere from 2 to 3 day recovery up to 3-4 week recovery. Depends on the severity, depends on the type of surgery, depends on how bad the tissue is that we're dealing with. You know, it's one of those things where I explain to my patients, if your construction on your house is using wood that's very weak, it's going to take a little longer, and it's not going to be quite as good of a repair as if it's good, firm material. Same thing here. So the better health a lady has, the quicker she'll be back at her regular activity.
Go ahead.
And also, the quicker she comes to see us with these problems, the quicker we can assess whether or not there is some help. About 20 to 25% of all ladies that come into a urogynecologist's office for urinary incontinence are turned away because they're past a point of no return.
Why do you think they wait to that point? Is it just they don't want to have that conversation? They feel it is just something they've got to live with? Why do you feel they let it go to that point?
There's 2 or 3 different reasons. First is embarrassment. The first step that ladies should take is to admit that they've got a problem. I've had a lot of ladies come in with their husbands, and the husbands had no clue that they've been incontinent of urine for 20 years. So it's an embarrassing issue for a lot of ladies to bring up, firstly. And secondly, a lot of ladies just felt that there was not any help available. And so for these reasons, they tend to stay away. By and large, the most common reason, however, is going to be there are certain mechanisms that ladies can employ to try to cover this problem up.
Okay. Well, thank you, and we're about to run out of time here. So just real quick, if someone would like more information, can they give you a call?
Certainly can. I'll be happy to help them.
Well, thank you for being here.